Welcome to the BCEN and Friends podcast, where we hold interesting conversations about learning with a range of thought leaders, BCEN certification holders, and industry professionals. Our goal is to create value and insight for you, our professional nurses across the emergency spectrum. We hope you find our discussions interesting, informative, sometimes funny, sometimes serious, and always worth your time.
In this podcast episode, we want to introduce you to our BCEN friend, Adam Vilander. Adam's career spans pre-hospital care, the ER, critical care, and flight nursing. And through it all, he's chased his goals with determination while navigating some of the hardest experiences nursing can bring. His story is packed with lessons, perspective, and inspiration, so buckle up. This episode is called Don't Let Your Dreams Just Be Dreams.
I'm Holly Briggs, a professional development specialist at BCEN and one of your hosts for today. I'm joined by my co-host, Michael Dexter, Director of Professional Development at BCEN. Hi, Michael.
Hey, Holly.
In this episode, we're joined by Adam Vilander. Adam is an experienced emergency nurse whose career has taken him from bustling level 1 trauma centers to remote island clinics and international volunteer missions. With a background as an EMT and over a decade in emergency nursing, Adam is sure to have lots of advice and insight to spare. So, Michael, could you please introduce us to our BCEN friend, Adam?
Yeah, I would be happy to. Adam Vilander is a master's prepared nurse educator with over a decade of frontline experience in emergency and critical care settings. He currently serves as the emergency and trauma nurse specialist for Samaritan Health Services, a 5-hospital system in Oregon, where he leads clinical education, trauma initiatives, and quality improvement efforts. In addition to his leadership role, Adam works as a flight nurse, delivering advanced pre-hospital care and transport for critically ill and injured patients. His expertise spans trauma resuscitation, rural and remote emergency care, and high-acuity operations. Passionate about evidence-based practice and nurse development, Adam is dedicated to advancing care delivery and improving outcomes in complex, high-pressure environments. Adam, welcome to the BCN and Friends podcast. It's a pleasure to have you with us.
Hey, thanks for having me. Happy to be here.
Well, we are looking forward to our conversation, and I know there will be a lot to dive into. And I am a little bit curious about these remote island clinics and international volunteer missions. But before we do that, I just wanted to go back and discuss how you got to the current role you're in, a little bit about your professional journey and any past experiences that led you to where you are today as a nurse specialist and as a flight nurse.
Yeah, I think where I'm at today, both as a clinical development specialist for emergency and trauma nursing and as a flight nurse, is just a culmination of really everything I've done with my career up to this point. Starting off as an EMT and working both on a 911 ambulance and doing special events. It was kind of my introduction into healthcare. And from there, went on to be an ER tech, starting off at one of our level 1 trauma centers here in Emmanuel. And that's where I really got exposed to what emergency nursing really is and realized that's what I wanted to do. So had kind of switched paths at that point from EMS and looking at going on to paramedic school to nursing and emergency nursing specifically. And then eventually transitioning to ICU. I think that experience of EMS, emergency nursing, and ICU gave me a really good, well-rounded experience and preparation for working as a flight nurse. And then in terms of, education and nursing clinical development, I think just my experience in ER, it spanned, I think, like you mentioned, a variety of different environments. Working in big, busy level 1s, tertiary care centers, and academic hospitals to critical access and rural facilities. And then spending about 2 years working as a travel nurse in Guam in the South Pacific. And technically, by definition, the hospital in Guam isn't critical access. But when you have 2 hospitals on a remote island, I kind of feel like everything's critical access at that point. So I think all of those experiences gave me a really good perspective and a really good ability to be an educator and a clinical development specialist with that focus on emergency and trauma nursing.
What led you into the flight world specifically? Did you go into nursing planning to be a flight nurse, or did it just kind of grow over time once you became a nurse?
I remember working as an ER tech at the trauma center and seeing the flight teams come in and asking someone, who are those guys? Like, oh, they're nurses and medics, and they fly in a helicopter and bring patients to the trauma center. Like, this sounds like the coolest job ever. Like, how do I do that? Um, and there was definitely an interest there, but after I became a nurse and kind of lost sight of that goal and started travel nursing and was really enjoying the emergency department, but eventually hit a point in my career where I felt like I was ready for something else, but I didn't know what that was. And I ended up having a conversation with a friend of a friend who was a flight nurse. And we kind of started talking about things, and it really just reignited that interest in me and that passion. And I, at that time, was working per diem in the ED and working pre and post op as a part-time job. So kind of filling in my hours with ER work. And at that point decided, okay, I want to get into flight nursing. I'm going to get back into the ED full time. Immediately applied for a flight position and did not get it. I was not prepared for the clinical questions. And quite frankly, I didn't have the minimum certifications required. So I did not get that job, but I will tell you that failure is one heck of a motivator. And that really lit a fire under me to do better and take advanced trauma courses and neonatal resuscitation and get advanced board certifications. I got my CFRN before I even had a flight job. I got my CCRN before I worked a single shift in an ICU. I wanted, when the next opportunity came, when I had an interview, I wanted to be undeniable. And one of the ways I figured I could do that was through board certifications, advanced course certifications, and really give myself an opportunity to shine in the interview. Because in my area where I work, for every one flight nurse position, there's about 100 applicants. So right out of the gate, you're competing against 100 people. So very competitive. And I just knew I wanted to do whatever I could to stand out. Started working in an ICU to get a little bit more of a variety of experience for flight, because a lot of what we do is critical care transport. We do a lot of interfacility transfers going from ERs to ICUs or ICUs to higher level of care ICUs. So really understanding the critical care is important. And so I did that for a little bit, really felt like it wasn't for me. This education job came available and I jumped on it. And it was a great move, a great decision. But after doing that job for a while, I was still just feeling like I had this goal of becoming a flight nurse, and I didn't want to feel like I gave up on it. I didn't want to feel like I quit. And so I applied again, and everything has worked out with scheduling, and I'm very fortunate, and I'm gonna go with it.
I absolutely love the tenacity, just that I am not going to give up. I'm not going to give up on myself. I'm not going to give up on this dream that I have or this goal that I want to reach for. And I agree with you wholeheartedly, Adam, that there have been a lot of lessons in my life that I would not have really probably embraced fully had I not failed at them. So, success is great and everybody pats you on the back. Not so many people are jumping in when they're like, we're so glad to hear you failed at that. I know this is going to be a real turning point for your career. So not as many high fives when you don't meet your goal, but I feel like personally, there have been a lot of lessons and a lot of deep-seated motivation that has come from not succeeding the first time and failing at something, having an opportunity to try again. And there's so many takeaways in what you talked about just in that first question and follow-up that I hope anyone listening to this is encouraged that, look, you can try again. Like you said, I went in and I wasn't prepared for all of this. And then I just took some time, whether that be months, years, whatever. And when you went back, you were fully prepared. I love when you said, like, I wanted to be undeniable. Like, oh, that's so good. Like I said, I could rewind that back. I mean, I'll be editing this, so I'll do it. I will listen to it again. Okay. Let me ask you this, because I know you talked about some of the work that you did in Guam, and truly, I don't know that I've heard of a more critical or rural access than that. Where you currently work at in the health system that you're in Oregon, you've got that critical access, you've got that rural aspect as well. And then in flight nursing, you operate within limited space resources. Again, lots of similarities between the environments that you're currently working in and have worked in. So, how do you adapt to that, both in the air, when you're serving your rural communities in Oregon? How do you adapt to that and be successful?
Yeah, it's a great question. And I think there's a lot of parallels between working as a flight nurse in critical care transport and working at a critical access hospital or working overseas in Guam. And those parallels, those similarities are doing the best you can with limited resources and finding creative ways to get the job done with the resources you have. I can think of an example when I was a staff nurse out at the critical access hospital in the Oregon coast. And one day during the winter, we had snow out at the coast, we had icy roads, and we had a full ED. So all 7 beds of our ED were completely full, but that wasn't stopping people from coming in. And so I think we had maybe a couple sick calls or people who couldn't make it in. So we had one physician, myself, and one other nurse to run the emergency department. So we had to find creative ways to do this because we already have 7 patients, right? We're boarding patients. We're going to be boarding them our whole shift, maybe longer. And at least one, maybe 2 of these patients was high acuity ICU level patients. So how do you do that, right? So having to troubleshoot that, talking it out with your physician and with the other nurse on staff. And this is the situation. These are the resources we have. What can we do? And kind of coming up with creative options. Just because you don't have more than 2 experienced nurses, ER nurses on the floor, doesn't mean we can't pull someone from med-surg. We can do that. And we have some lower acuity patients. We're boarding med-surg level patients. Let's assign that nurse to those patients. We had an outpatient infusion nurse come in, and one of her infusion patients was one of our ER patients. So she was just like, hey, how can I help? So she took that patient. So we were able to make it work, kind of divvy things up. Of course, not the ideal situation. We ended up having probably 13 or 14 patients. Not ideal, but we can make it work. We can still provide safe care and get through the shift. And what that looks like for flight is, okay, so we operate 1 nurse and 1 medic. And a lot of times when we get on scene for like a scene call, we'll have several paramedic level providers on scene as well, and they can help out, but not always. We might only have EMT level care in some of these rural environments when we're responding like a scene called trauma. But just because someone's just at the EMT level doesn't mean they can't do anything, right? If you're an EMT, you can keep track of time while we're working this code. I can have an EMT time record, document, do chest compressions, bag a patient if I need to, and carry all our gear back out to the helicopter because, we've got a ton of bags. So just because someone isn't at that level of care doesn't mean they can't help. You can cast people out on things and make use of various skill sets. I've had times in critical access nursing where we might have to have someone from environmental services come and help move a patient from the EMS gurney to the hospital gurney or be on deck for chest compressions. We have to do what we have to do to get the job done. So I think there's a lot of similarities between working with limited resources in a critical access or remote hospital and working in the pre-hospital medevac environment.
There definitely is. And you going through that reminds me of a lot of different similar situations that I've had over the years where you're having to think on your feet quickly. And often there's times when you absolutely don't even know what to do, but having no knowledge of what to do in some of those situations, but still being able to communicate well, I think is vitally important. And I specifically remember one time when I was working on the ambulance where I called report to the hospital and I said, I honestly don't know what's going on, but I need every person in the ER there when I show up because this person is crashing quick and I don't know why. And it ended up being a metabolic GI type of issue for them. And they trusted that just because I said I need help, they came and they helped. But in the moment when you're by yourself, you have limited resources and you're trying to figure it out, it can be tough. And I think that gets right into the next thing that I wanted to talk about, and that is there's this fine line between people that go in with brazen confidence and people that go in with competence. And I think there's a lot of competent nurses that are a little bit hesitant to go into situations because they feel like they are, we hear this term imposter syndrome a lot. They feel like I am competent to do things, but I'm not the best, or I'm not well suited and things. And so I'm just curious what your thoughts are, because you mentioned earlier getting your CCRN before you step foot in the ICU, or getting your CFRN before you flew. And I'm sure that there was some pushback from some people saying, oh, well, if you haven't worked in this environment, why are you doing that? But at the same sense, I think it gives a confidence level. And as you build more experience, a competence as well. But curious what your thoughts are on how do you kind of wade through those waters of wanting to do the best thing, wanting to feel competent, but at the same time knowing that there's just some situations that you have sometimes have no control over, and you just have to rely on what you know.
Yeah, for me personally, I've experienced these feelings of insecurity or imposter syndrome a couple different times in my career. One of them was when I transitioned to being an ER nurse to being an ICU nurse. And I remember being off orientation, and I was brought a patient, I don't know, from OR or cath lab or having a procedure done, and they ended up needing to be intubated and come to us for a while. And the OR team just kind of dropping off the patient, everyone left. And then here I was standing alone in this room with a vented patient on multiple drips, and just kind of having like this inner moment of panic, right? Where inside I'm kind of thinking like, oh man, like what, like this isn't what I'm used to, right? Even though I've dealt with this type of patient before, an intubated patient on multiple drips, like I've done this plenty of times, but in the ER setting. So yeah, I'm just having like this mini kind of internal freak out where I'm just like, oh, I don't know what I'm doing, but just being able to like slow down and think about things and tell yourself like, no, you got this, like you can do this, you've done this before. And so I think kind of the first step for me with dealing with those feelings and this imposter syndrome is just recognizing what's going on. Like, hey, I'm having these thoughts, even though I've done this before. I'm kind of having a mini panic moment, but that's okay because I've been a nurse long enough. I know I'm holding it together on the outside. So, so we're good there. And focusing on positives, right? It can be really easy to get sucked into focusing on negatives. And a lot of the education that I do in my education job is with new grads. I run the new grad residency program. I work with them a lot, and kind of managing and dealing with these thoughts and imposter syndrome is something I like to talk about with them. And so focusing on those positives and not just dwelling on the negative. You can use, say, IVs, for example, tends to be a common one with new nurses in the emergency department. Not just focusing on what went bad today, like, oh man, I missed all my IVs. I missed 8 IVs today. I'm a terrible nurse. But being able to focus on some of those positives. Yeah, I missed those IVs, but you know what? I had a patient that came in with a really bad attitude and didn't like me, didn't want to be there, but I was able to kind of turn that around. And by the end of our interaction, like they said, thank you. Like that's a win. That's huge. So being able to identify those positives. And then also kind of restructuring those negative thoughts, right? So instead of looking at the situation with the IVs, like, oh man, I'm terrible at IVs. I suck at IVs. Well, no one's just inherently bad at IVs. You're not just bad and you're always going to be terrible at IVs. You have to kind of break it down and look at, well, why is that? What am I doing incorrectly? Am I struggling with finding a good vein? Or am I blowing through the other end of the other side of the vein? Let's break it down and what can I do to improve on that? So I think those are kind of some important kind of ways to deal with those feelings and with imposter syndrome. And then also just not really comparing yourself to others or being careful who you compare yourself to. If I'm new on a unit, maybe I'm a new nurse in the ICU, I'm an experienced ER nurse, and I'm comparing myself to an ICU nurse that's been on that unit for 10, 15 years and knows every policy and procedure and can deal with anything in any one of those rooms. Well, yeah, I'm never going to measure up to that. We have to be careful of how we do that. And then I think also just like seeking support, and whether that's through a coworker who's going through a similar situation, maybe you're a new grad, another new grad that's experiencing some of the same things, or I was fortunate to have a mentor in my first ER job. And it wasn't like a formal mentorship. He was my preceptor and we became friends, and he really became someone that I could talk to and lean on when I was having some of these feelings of insecurity or not, measuring up to the standards that I thought I should be meeting. And I know that there's some departments out there and some hospitals that have formal mentor programs, and I think that's fantastic. But just know that if you're not working somewhere that has one of those, it doesn't mean that you can't have a mentor or find that support somewhere else.
I, again, don't know if I should just put that last answer on repeat. I don't know if we should just loop it for people to hear a couple of times, because the truth is, Adam, I hear it constantly when I'm talking to nurses about this fear of being incompetent, fear of transitioning in a role or trying something different because they aren't sure. And when I think about my own personal professional journey, I see that there were times when I definitely had those feelings of that I'm not going to be the right fit and that I can't be that. And so the advice that you gave was really solid in that you do have to kind of manage your emotions. You have to think positively, kind of change your focus, really break down those problem areas. And instead of it, everything just being bad and you're bad at everything, like what is it that you're really struggling with, and kind of honing in on those areas and putting in the work. And I think your last piece of advice about mentoring is so helpful. I think that a great mentor is someone who not only can be like that role model, but they can also help you see that you're going to be different than them. They're going to be different than you. They're going to have strengths that you're not going to have maybe. And I think that when you try to compare yourself to everybody, like, of course you're not going to measure up because we're all different. It's okay that we're not all the same. So again, great answer to a very difficult question. And I feel like most nurses face that in their career, and how they overcome it says a lot about them personally, but also, again, just great advice. So there's this saying in nursing that old habits die hard, especially in scrubs. And I've never identified more with this statement than as a new grad nurse. Like I felt this so hardcore that I was like, why? I would ask questions like, why do we do this? And I would hear, that's because we've always done it this way. Why are you asking questions? And so, not that it changed my natural curiosity and tendency to ask questions, but I felt this. And then there are times in my career where I was like, we just do it because that's what we do. And so I feel like this thing is pretty true. And you work in education. So how have you successfully applied adult learning principles, because that's huge, we're all professionals here, we're all adults, right, to help experienced nurses adopt new practices when you're doing trainings or doing education? How are you breaking these old habits that really have a hard time dying?
Yeah, and that's a big question, because that can be tough, right? And and what you said about just asking the question why, I feel like in my experience, that can be a trigger sometimes when someone's teaching you something and it's a simple question and it's a valid question. Well, why? Why are we doing it this way? And I think a lot of times people take that as you're questioning them versus asking a question. So definitely been there. And change can be tough, right? I think nurses, we're a fickle bunch. We don't like the way things are, and we also don't like change. So it can be difficult. In terms of utilizing these adult learning principles to implement change, there's a couple things. And I mentioned before that a lot of what I do is with new grad nurses, but I do quite a bit of education with all staff, our experienced staff as well. And one thing that's really important is just recognizing their experience and not treating them like they don't have experience or they don't know anything. And that goes for experienced nurses and new grads. So many of our new grads now are coming out of nursing school with a fair amount of experience as CNAs or ER techs. We have EMTs and even paramedics sometimes. And so just recognizing that experience that they bring, because it does bring value. It brings value not only to what they're doing, but to the organization. So I think that's an important part. Also, what we're teaching needs to be applicable to what they're doing for their job. I think there's two really quick ways to lose a group of nurses specifically. And I'll even go a step further and say a group of ER nurses, because that's mostly who I teach. And those two things are, if they think that you don't know what you're talking about, you're going to lose them. No one's going to pay attention. No one wants to hear what you have to say. And then also, if it doesn't apply to what they're doing, if they can't find value in what you're teaching and how that's going to apply to being a bedside ER nurse, you're going to lose them. And once you lose them, it can be very difficult to get them back. One thing I find helpful in kind of making that application to their job evident is including case studies. I'm working on a case study right now. It's a multi-system trauma patient case study. It was actually a patient that I picked up in flight from one of our emergency departments. So working on that case study to kind of bring together all these different aspects of what happened in their emergency department, what we did in flight, and then the care that was provided and what happened at that tertiary care center. Bringing that information together and presenting it in this case study format that is a patient that was actually in their emergency department, I think is pretty valuable. And I'm hoping that we'll see the value in how that applies to their job, because it's a patient came from their department. I also think including not just clinical education, but operational education. And I think this is a distinction that we make in flight of clinical operations and more operational stuff. But if we look at, say, a STEMI, for example, if I'm providing clinical education on a STEMI, that's great. I'm talking about pathophysiology. I'm talking about the pharmacology and medications and how we treat it. Operationally, what do I do once we've identified a patient has a STEMI? Who do I call? Do I have a cath lab in-house that I notify? Or do we need to ship this patient somewhere else? In terms of treatment, what does that STEMI order set look like? Who do I call to get to this patient to where they need to go? So including both clinical and operational, I think really helps nurses find value and recognize that the education is applicable to what they do. And then lastly, I would say involving hands-on learning. I think a lot of nurses, we're kinesthetic learners, we're hands-on learners. I'm multimodal. I need to see it, I need to hear it, I need to get my hands on and touch it, and I need repetition and all those things. So I think this kinesthetic and hands-on learning is really important, especially when we're talking about equipment, right? If we were, say we're rolling out new IV pumps, and the only education that I gave on this new IV pump was, here, watch this video. I mean, some people would probably pick it up, but some people aren't. If I tell you, hey, watch this video, and then I hold an in-service and everyone gets their hands on the pump, they get to program it, they get to load it, they get to troubleshoot it, that education is going to be so much more valuable, and it's going to stick. So these are just ways that I really try and incorporate those into what I do. And then also a big one for me is I don't want to lecture at you for an hour. Kind of the way I break it up is, hey, we're going to talk about something for 20, 30 minutes, and then we're going to get up and we're going to do something. I'm going to give you a lecture on RSI, and we're going to break down the process, the prep, the medication, and then we're going to go over here and we're going to practice drawing up all the meds. We're going to push the meds. We're going to do the dosage calculation. And then you know what? Then we're going to go over here and I have a glide scope and we're going to practice the intubation. Not because as an ER nurse, you're going to be intubating someone, but the more information you have, the better prepared you're going to be just to help out with that situation. Being aware of these advanced procedures and how they're done just makes you better prepared to be in the room and be helpful when they happen.
Adam, how do I sign up to come to some of your classes? That's
Well, I'm doing a webinar with the BCEN in November on critical care and the ED. So
oh, well, there you go. It's great. I think that's great. I think you're spot on with that too. I would sometimes get frustrated when I felt like education was just checking a box to say we did it, rather than to see the light bulb go off of somebody understanding why is this important. There's some things that seem a little bit silly, maybe sterile technique or something. Somebody's going, I've been here for 10 years. We have to do a sterile technique thing every year. Might seem silly, but when you go through the impact that doing something in a non-sterile fashion can cause and the way the harm it can cause, and you go through these things and then you present the information in a different way, it makes people go, you know what, this is important. I want to come back every year and I want to make sure that I'm doing the right thing versus, oh, it's that stupid sterile technique in servicing. So, yeah, I think there's so many different ways that we can rethink education and make it really adaptable to each learner. I appreciate you sharing that with us. And,
yeah,
Adam, you have a lot to be proud of in your career, and you've done a lot already. But just out of curiosity, because we like to ask everybody this question of, is there some person, you mentioned your mentor when you first started, but is there some person that you have felt has really changed who you've become as a nurse over time, or maybe like a certain patient or an incident that happened that really molded you into the clinician and educator that you are today?
yeah, I would say I have two examples for that, if I may. One of which is it was my mentor who, when I was in ER tech, this nurse, Mark Thomas, he said, "Hey man, you've got what it was, 1 or 2 terms left in nursing school, and you're going to be a nurse and you're going to work here. So I'm going to teach you how to be a nurse." He said, "Don't go help that nurse empty that bedpan. You're going to come with me and you're going to learn how we do a sepsis workup." And really kind of took me under his wing when I was still in ER tech and I was still in nursing school. And so I was really able to start learning how to be an ER nurse when I was in ER tech. Um, and I say how to be an ER nurse because nursing school, right, it doesn't prepare you to be a nurse necessarily. It especially doesn't prepare you to be an ER nurse. It prepares you to pass the NCLEX, which is important, don't get me wrong. But having someone at the bedside who was just able to show me the ropes and basically get started with my preceptorship while I was still in nursing school and working as an ER tech. And then he was my preceptor for the 12 or 16 weeks and remained someone that I could go to with questions and advice. And we're still friends to this day. So that was someone who had a really big impact on me. And then I had a patient that had a really big impact on my career and on my life. And I think it was probably in my first year of nursing. And we had a pediatric code come in. And this 5-year-old little girl named Bailey came in cardiac arrest. And I say her name for a couple of reasons. And that's out of respect for her and her family, because so much in nursing, you know how it is, we refer to patients by their room number or their chief complaint. But this was someone's daughter and someone's sister. And also, I used to not be able to say her name without just breaking down completely. And not just crying, I mean like ugly crying, right? Like snot bubbles, where like you're a kid and you're crying and you can't catch your breath. Yeah, me, I'm a grown man doing that if I just think about her or say her name. And she died in our ER that day. And I was able to kind of go outside, catch my breath, pull it together, and then come back and finish the other 10 hours of my shift. And to get through the shift, I felt like I just had to kind of push it down and not deal with it. And I continued to do that for another 6 or 7 years. And it just came to a point where I ended up leaving the emergency department full time and just doing per diem ER work and then working outpatient infusion and pre-op, post-op type stuff. And kind of even went as far as to look at leaving the profession of nursing altogether. But between working as a nurse and an ER tech, I mean, working in emergency departments is the only thing I've really done with my adult life. So I'm thinking maybe I'll start my own handyman business. But, guess what? I'm really not that handy. So it doesn't make sense. It became pretty evident that this was just something that I had to deal with, and ended up talking to someone, going through therapy. And it was so incredibly helpful. It was like this huge weight had been lifted off my shoulders, just talking to someone about that event. And then also talking to some of the staff who were in the room that day, and realizing that, oh, I'm not the only person who was in the room that was affected that way. Like, everyone was affected that day to some extent, and realizing that it wasn't just me because I was a new nurse or I'm weak or whatever it is. It's because I'm human, right? And because I'm human, you got to talk to someone. You have to deal with those things. And so that would just be kind of my takeaway, and my message for everyone out there is, as nurses, especially working in the emergency department, we're going to experience things that most people don't have to. And for us, it's part of our job. So it's really important just to take care of your mental health, talk to someone. I just can't stress how helpful that was for me. And it got me to a place where I was able to go back to the ER full time, and where I was able to go after this dream and this goal I had of becoming a flight nurse. And I wouldn't have got there if I had never done that. So
thank you for sharing all of that, Adam. Not only the mentorship aspect and having somebody see such potential in you and recognize it and use their position to kind of further yours, right? To kind of bring you in. And then also just the recognition that compartmentalizing in a profession like this, it's not possible. It's just not possible. It might work for a couple of hours. It might even work for a day or so, but there's just no way to take away the humanity and the connection that you have to your patients, because that is our job. And that's what we're given the opportunity to do, is connect with people on their worst day. And we become a part of that, and we take that with us. And I think recognizing that, getting help, whatever that looks like, it's important to allow us to be human alongside the humans that we're taking care of. And when we don't do that, we really shorten our lifespan in this profession. We really do. And I'm so grateful that you had the vulnerability and the willingness to allow yourself the chance to heal and process things, and then regain that passion to stay in the profession and pursue your dreams. It's a huge testament that it is possible, because I think a lot of times people feel very alone about things they've experienced, seen, done, have done to them. And they feel like, well, nobody else feels this way. Everybody else is fine. And I love what you said when you talked to some of your other coworkers, and you were like, no, I wasn't the only one who was affected this way by this patient. And I think that's really huge for people to hear. You're not alone in the way that you feel about it. You just got to be willing to talk about it, which that's why we need to have podcasts about medical people, because we need to talk. Again, I can't wait to edit this. I'm going to get to listen to this all again. So I will repeat this advice in episode. So I am going to jump into our rapid fire questions. Now, these are just some questions so we can get to know you better as a person, as a human. Now, I know you said that you thought about being a handyman, but you decided against that. So what I will ask is, if you weren't in your current role, but you wanted to try out something else, what would you try?
I think I would have to say pilot. Like, working with pilots, working as a flight nurse, it seems like a pretty cool job. And let's be honest, no one cares about the medical crew. No one cares about the flight medic or the flight nurse. It's the pilot. The pilots get all the glory. Seems like a cool job. And I think it'd be fun.
Due to recent travel issues that Michael and I have encountered, we've actually both been talking about just getting our pilot's license so we can get
I was actually going to say, maybe we could all join together in taking flight school, because I'm also planning to become a pilot out of necessity more than out of changing career.
We're just going to get see about, does Groupon still exist? I don't know, but if there is, maybe we can get a 3-for-1 special or something. I don't know, but sounds like a great idea from where I'm sitting. Okay, here's a few favorites. What's your favorite book or a quote that kind of inspires you?
I would say my favorite book is Fight Club. And I think it's because, well, it's a great book. And it was really one of the first books that I read and enjoyed, and actually got me into reading books for fun, not just for school. So it kind of, it opened that door for me. Not only did I finish it, I think I read it in a day. And so, yeah, it really got me into reading more. So I'm going to say Fight Club.
I feel that. My gateway books were The Chronicles of Narnia, the whole series, Gentleman, and Hatchet. I wasn't a big reader before them, but when I was a little kid, like something clicked and I was like, this is the best thing that's ever happened to me. I can go anywhere in these books. And so, yes, if you don't like to read, you just probably need to find what I like to refer to as your gateway novel, and you will be in. Okay, you'll be in. All right. Favorite movie, TV show, or a binge-worthy series, because we're always looking for the next best one.
Favorite series has got to be The Office. I just feel like it's classic. It's so good. I've probably seen each season multiple times. Definitely one of my favorites. More recently, I've been watching White Lotus, which is, a little bit different route, different genre, but also it's been pretty good.
Okay, I've heard that about White Lotus. And honestly, The Office, it's kind of, I feel like it's our generation's Seinfeld.
Yeah.
For me, if The Office is on, it's just comforting. And I'm gonna know the episode, but I'm waiting for the best line, the twist. So,
Oh yeah. And I feel like Dwight K. Schrute has got to be one of my just favorite characters of anything of all time. I just look at him and I laugh.
I used to love this idea of like trying to figure out who you worked with on the unit, who kind of was like that office personality. And I feel like everybody has somebody who's the Dwight. Everybody does. I mean, and if you don't feel like you do, you may be Dwight. You know what I mean? So just embrace it. He's a complicated character, but he's so funny. Oh, so, okay, favorite song or a musical artist that can just kind of move you?
I'd say, I'm a big Jack Johnson fan. I feel like I can just put that on and relax and make dinner or hang out with friends. It's just a really, just kind of classic go-to for me.
He's so chill. I feel like hearing his voice is like waves, just in a kind of peaceful, not like waves you could surf on, but definitely a great recommendation. All right. Adam, do you have a self-care go-to or a way that helps you reset?
Get outside, go for a hike. It just helps me reset, recharge. I'm pretty fortunate living in the Pacific Northwest. Got a lot of great hiking out here, and pretty much no matter where you live, you're going to have trails that are accessible. I'm fortunate that I live fairly close to the Oregon coast, so we've got some good hikes on the coast that are a good driving, not too far away. But yeah, just getting outside, connecting with nature, getting some physical activity in is just a great way to reset.
Thanks for sharing that. Now, if our audience would like to follow you online, is there a social media platform or a best way to reach out with you?
Yeah, I'm on LinkedIn, or you can contact me via email at avilander@samhealth.org.
Awesome. And I will include that in our blog for this episode. So thanks for sharing that.
Thank you.
Well, Adam, thank you for being here with us today and talking about all things emergency, trauma, flight nursing, education. It's been really great chatting with you, getting to know more about you. And I just really appreciate your insight and your expertise into the world of emergency nursing. And for those that haven't heard, you did a great job with the online virtual summit when you presented there. And you already mentioned another webinar in November, and you'll be in the Destin conference in October. So I think we're just running you ragged. I feel bad asking you to do all these things when you're already so busy with all the other things you're doing, but you're doing such an excellent job with all of them. We really appreciate it and appreciate the passion that you have for emergency nursing. And on behalf of many people that I don't know, but I'm sure would agree with me, thank you for not leaving the profession when you wanted to at one time.
Thanks for having me and giving me the opportunity to talk and share some of these stories. Yeah, I really appreciate it. And I look forward to the other events that I'll be doing with BCEN. And, I am busy, but the thing is, I love everything that I do. So when you enjoy it, it doesn't always feel so busy. And it's really important to me to be able to give back to nursing, to give back to this profession that really has given me so much and that I've dedicated my career to. So I'm happy to do things like this. I love it. I truly enjoy it. and being able to make a difference in patient care and the communities that I serve through education is really important to me. And I'm just thankful for the opportunity to be able to do that.
Well, I want to take this time to thank Adam for joining us for this episode of BCEN and Friends. Adam, thanks for sharing your honest insights and experience with us. Your positive outlook and determination to push through challenges are not only inspiring, but instructive. You've shown what it means to grow through adversity, and your impact on this profession is truly valuable. We're looking forward to spending some time with you at Destin Learn Live coming up in October 13th through the 15th of 2025. We're grateful for everything that you're doing to help shape the future of nursing. And to all of our listeners, stay tuned as we bring new insightful episodes of BCN and Friends. If you have an episode suggestion, we'd love to hear from you. You can send us a message to bcn@bcn.org. I'm Holly Briggs here with Michael Dexter, and on behalf of the entire BCN team, we thank and celebrate you for all that you're doing as professional nurses across the emergency spectrum. Until next time, we are out.